let me get into some of the symptoms of depression.
Yeah.
Okay. And depression can mean different things to different people. Everyone experiences their depression differently. So what I'm going to go through are just general guidelines. We have a manual for clinicians in the United States that most other countries use, and it's called the Diagnostic and Statistical Manual of Mental Disorders. We call it DSM-5. It describes depression. It lists about 9 symptoms. 9 symptoms. And if anybody has about 5 of these symptoms, 5 or more, and it lasts for more than 2 weeks, it lasts for about 2 weeks, then we will say that you are suffering from what we call major depressive disorder. And now let me go through some of the symptoms. The very first symptom is depressed mood. Depressed mood is when you just feel down, you feel excessively sad, okay, and the sadness does not lift. It is not just the regular sadness that we experience, oh, I'm not very happy, and then the next moment you are happy. No, that's not what we're talking about, but sadness that keeps you down most of the day, nearly every day, okay, that may be explained by some happening in your life, or sometimes you just have no idea. Things are going well for you, but then by the time you realize you are in tears, okay, or you are moody, and it can be, sometimes it can be seen by the people around you. All right, so that's the first one. The second one would be loss of interest. Loss of interest. That is when there is or loss of interest in pleasure or the things that you used to enjoy, right? There is a marked, reduction in your desire to engage in your hobbies. The things that brought you joy are no longer bringing you joy. Yeah. And it's persisting and it's going on for a while. Unexplained fatigue is the next one. Unexplained fatigue. That is when you are excessively tired, you've lost energy, and you have not done any significant physical activity that can explain that level of tiredness. And you just don't have the energy. Sometimes you don't have energy to get out of bed, right? Yeah. And you may even call into work and say you are not able to come to work. And it seems to be a pattern, then that is a pointer to the fact that something is going on that needs to be checked. And the other one I would say is the feeling of worthlessness or low self-esteem or excessive guilt, right? You feel you are not worthy. Who am I? I'm not as deserving as other people. And you may be blaming yourself more than usual. Oh, it's my fault that this went right. If I had done, maybe you lost some loved ones and you are grieving. And after a very, very long time, we call it prolonged grief, when you are still blaming yourself for things that happened, 10 years ago, 5 years ago. And it becomes excessive. Okay. Those are some of the things. Now, the other ones that I remember: decreased concentration. You're not able to focus or pay attention at work, and to get work done. You are no longer as productive as you used to be. And then we have changes in appetite, right? Sometimes you are eating a whole lot more, and when somebody is eating a whole lot more, it may be a pointer to the fact that there is a void that you are trying to fill using food. Some people would actually resort to using substances to fill that void, right? And they may self-medicate. Or you have lost appetite. You just have lost appetite, and that can be seen in your weight. You might have gained a whole lot of weight within a short time, or lost weight within a short time. And then there are sleep disturbances also, insomnia or hypersomnia. And insomnia is when there is a significant reduction in your ability to get restful sleep. Maybe you have difficulty falling asleep, difficulty staying asleep, or waking up earlier, much earlier than you planned to. And it becomes a pattern, or you're sleeping a whole lot more. Some people would sleep 12 plus hours, and it becoming a pattern for you. And that is unhealthy. Okay. And the last one I will mention is the thoughts of suicide, or not wanting to be here. That feeling of worthlessness would usually cause people to begin to ask themselves, what's the point? Why am I here? I will be better off not being alive. And then that lingers on, and then causes you to begin to think about what to do to check out of life. And if you ever get into that space, and I can tell you in clinical practice, we talk to many people who are in that space. It's going on in their mind. What's the point in life? Why am I alive? And if you are ever in that space, I would strongly admonish you to talk to somebody. Talk to somebody. I mean, talk to a professional, talk to a family member, and then get some help ASAP. Talk to your pastor. I think in these days, we don't really, let me use the word, utilize our pastors enough. We do not. It used to be the case that pastors were the first point of contact, that everything that's going on in our lives, we run to our pastors. But I've realized that in this current generation, the millennials and, the Gen Z and all that, they feel like I can do it all by my own. I can handle it, and then they wait until it is too late.